Lawmakers to ban gender-affirming care for minors is a vote closer to the governor's desk.
This bill limits what healthcare providers would be allowed to offer transgender children for care. 12 News reporter Sean Logging speaks with a member of the transgender community about the impact this could bring. Sean?
Mike, Rachel, the Kansas House passed this bill 80-40 this morning. That is with more support than a version of this bill got last year. There were 4 Republicans absent, which would be the number of votes needed to override a veto.
Cleared path.
A bill that would limit gender-affirming care for minors in Kansas moving out of the House Wednesday.
These vulnerable kids are in a critical phase of emotional and psychological development. The irreversible nature of surgical interventions, hormone therapy, and puberty blockers are an unacceptable burden of Kansas kids to bear.
Republican leaders say 22 other states have similar measures protecting children's mental health and preventing life-altering decisions. Democrats voting against the bill say this doesn't help kids.
The threat of banning gender-affirming care at any age causes severe distress, suffering, and heartbreak for those in hope of a better future.
This bill prohibits healthcare providers from using surgery, puberty blockers, or other medical treatments for anyone under 18 whose gender identity doesn't match their sex. Jalen Abeg with Equality Kansas, closely monitoring this legislation, says providers work closely with patients to make sure transitioning is the right option.
Once these transgender children are identified, less than 1% of them detransition because they are not transgender. So it's a very effective path of care.
Another part of the bill would prohibit state employees whose jobs include working with children from things like using a child's preferred pronouns.
It can be devastating to children because they lose possibly the only point of contact with someone who can truly appreciate them and celebrate them for who they are.
A transgender woman, Jalen, says it's frustrating the trans community continues to see these types of bills.
This bill literally will cost lives. The statistics just indicate that. And the state legislature will be complicit in that.
Will ban state funds from going toward social or medical transitioning, and providers offering this care could lose their licenses. This bill now goes to the Senate. If the Senate moves it forward, it would then go to the governor's desk. Although last year, Governor Laura Kelly vetoed a similar bill.
Sean, thank you.